Okay, this is Cindy, Jeff, Zachary, Rebecca, Ricky and Raven, and Brandy. A student from Cleveland, Ohio tells after being placed in a psychiatric ward for more than a week, her school wanted to make her retake the entire year because she was not there over the period of time. When this was told to her at the hospital, she had a panic attack through all the hard work she had done to keep a 3.8 GPA. This is just one of the stories of mental illness being overlooked by the facilities closest to the general public. Growing up in a rural community, I've seen the fear of mental illness firsthand. The need to keep your problems hush-hush so people don't talk bad about you. I wish to advocate for cheaper and better resources for mental health in schools, work, and places throughout the general public. We will start by diagnosing the problems, then we will find the underlying causes, and finally we will treat the lack of mental health resources. First, we will find the diagnosed problems caused by lack of mental health resources. We will start with mental illnesses that are left untreated can lead to physical symptoms and illnesses. A constant overload of your mental health can weaken your immune system and leaves room for colds and other common bugs to happen more often, as well as drastic changes in your weight due to overeating or lack of appetite. Work and school performances drop as well as overall functioning in social settings. Burnout is a disorder that can affect both kids and adults alike. According to the November 26, 2013 Psychology Today article titled "The Telltale Signs of Burnout, Do You Have Them?", Doctor of Psychology Sherry Berg Carter states that burnout is a state of chronic stress that leads to physical and emotional exhaustion, cynicism and detachment, and feelings of ineffectiveness and lack of accomplishment. Previously stated source mentions that symptoms can include depression, anger, and forgetfulness. Work facilities that are understaffed, especially facilities that work with patients that have mental health issues, can cause stress and mental health issues for the employees. According to a July 10, 2019 phone article interviewed with CNA Medication A. Cindy Lowry, it is stated that we are understaffed 2 or 3 times a week on any given shift. People who have no outlet to turn to or that allows them to openly discuss how they are may turn to drastic measures. These measures include substance abuse, self-harm, and suicide. Have the numbers. Veterans are one of the highest groups to suffer from mental illness due to the trauma they went through. Mental disorders like PTSD and the issues of survivor's guilt show how the trauma is always thought about. According to a September 26, 2018 Military Times article, VA suicide rates for younger veterans increased by more than 10%. Journalist Leo Shane III reports that about 20 veterans a day across the country take their own lives, and veterans accounted for 14% of all adult suicide deaths in the U.S. in 2016, even though 8% of the country's population served in the military. All generations can struggle in silence. According to the American SBC Facts on Teen Suicide, on their front page states, according to the Centers of Disease Control, CDC, for youth between the ages of 10 and 24, suicide is the 3rd leading cause of death. Drugs and alcohol are used as temporary escape, normally retrieved through theft, illegal sales, and bribery if not old enough to purchase themselves. In a previously stated, elderly are a big case of treated patients. In a previously stated interview, it was stated that about 30 residents out of the 58 residents have some form of mental illness. Now that we have diagnosed the problems, we will find the underlying causes of the lack of mental health resources. Now we will find the underlying causes, and one of those causes seems to be a lack of focus around childhood, mental health, and forming good habits and proper coping mechanisms. According to the 2005 ebook, Mental Health, Facing the Challenges, Building Solutions, report from the WHO European Ministerial Conference, Chapter 11 states that it is now recognized that many mental disorders seen in adulthood have their beginnings in childhood. The prevalence of many psychiatric problems such as depression and suicidal behavior increase markedly in adolescence. Parents may not agree that something in the child needs to be looked into or taken care of, and those that are with them in school or daycare mistake the signs as simply bad behavior or an unwilling child. The blur between medical treatment and non-medical treatment can is strong. It is sometimes believed in strongly religious beliefs that mental illnesses are work of evil or punishments for wrongdoing. Some people do not know when to seek treatment or cannot afford it, and the lack of teachings about mental health give a breeding ground for doubt and procrastination. In a lot of cases, prices of sessions and medication prescribed is very high and cannot always be covered by insurance. Now that we find the underlying causes, we will find a way to treat the lack of mental health resources. Now we can find ways to treat the lack of mental health resources, starting with a change in the way we treat patients. From a previously stated source, Cindy Lowry offers us a suggestion: more evaluations and more time spent on diagnosing patients or anyone. Many different illnesses and disorders overlap and have many similar symptoms that are required to be diagnosed. When spending more time on studying symptoms of each patient, we can start to reduce the amount of wrong diagnoses. Having your medical practitioner consult more than one person to allow for different perspectives. They may say something the other doesn't and give the best diagnosis that way. We should also try to allow for various treatment options the patients to choose from. The biggest thing to remember is that all people are different when it comes to mental illness, so that even if people have similar symptoms, treatments for one person may not work for another. If you are able to remove the fear of just being forced to take medication or to be put in a hospital, more people may come. If possible, with the disorder or disorders in question, allow for non-pill type forms of treatment such as therapy, exercise, or aromatherapy. Even moving into some experimental marijuana solutions in areas where it is legal and safe to use. If all possible, find ways to help prescriptions be covered by insurances or be made cheaper. We need to provide adequately trained personnel in schools, workplaces, and the general public. Those who wish to see a change could contact out-of-state and federal representatives. We could use petitions and grants from federal governments to help pay for school counselors. They could come on certain days to certain schools with a determined time that students can come and talk if needed. Workplaces can talk to insurance companies about helping with costs of counselors for employees. This would boost employee morale and place trust in the company. In conclusion, it is us that have to take a stand if we want to see better health for us in the future. We have diagnosed the problems, found the underlying causes, and gave various ways to treat the lack of mental health resources. In my high school, during the 2016-2017 year, many students feared going to school and felt that for any of the issues they saw, they had been brought to the administration with no signs of anything attempted. And they felt that it would take a similar situation to 13 Reasons Why to get any attention from the administration. 13 Reasons Why was a book later turned into a TV show adaptation about a girl who leaves 13 tapes to people after she commits suicide. This is just one more story, and the clock is ticking.